Hello, this is Shanya of final year, and my topic is shade matching in restorative dentistry. Shade matching is crucial in restorative dentistry to ensure aesthetic outcomes that blend seamlessly with natural dentition. This process involves understanding shade guides, color perception, and various matching instruments. Now, coming to the tools of shade selection, first one is Vita Classical A1D4 Shade Guide. It is organized by hue A to D and value 1 to 4. Hue ranges from reddish brown, which is A, reddish yellow B, yellow C, and reddish gray D. And value ranges from the lightest 1 to the darkest 4 within each hue group. Now it is used as a common starting point for shade selection. The second one being Vita Bleached Guide 3D Master. It is designed for selecting shades for bleached tooth which tend to be lighter and less chromatic. It's arranged and grouped shades by value 0 to 5 with subgroups based on hue. M for neutral middle hue, L for less red, and R for more red. It offers a more systematic approach for selecting lighter shades and accounts for variations in hue and chroma. Now coming to custom shade guides, it provides more accurate representation of specific restorative materials or custom fabricated restorations. It can be used from resin, porcelain, or acrylic. Now coming to the principles of shade selection, the first one being lighting. Always prefer natural daylight and avoid artificial lighting which can distort the color perception. The next one being patient condition. Patient should always be relaxed with lips moist and teeth clean. Avoid matching immediately after polishing or if the patient has just consumed staining substances. The next being comparison. Compare shade tabs to the prepared tooth and adjacent teeth. Then value, which was considered first, is often recommended to select the value lightness or darkness first as it is the most critical factor for aesthetic success. Hue and chroma. Once value is established, select the appropriate hue and chroma. Now let's talk about the color matching instruments. The first one being spectrophotometers. They measure the spectral reflectance of a tooth or material across the visible light spectrum. They provide detailed data on value, hue, and chroma, often translated into color systems. They are highly accurate for objective color analysis and communication. The next one being calorimeters. They measure color based on human visual perception using filters that mimic the response of the eye's cone cells. They provide color values often in the systems like CIE. The third one being digital photography helps to document shade selection, communicate with labs, and aids in post-operative assessment. The equipments used are DSLR cameras or smartphones. But DSLR cameras are mostly preferred as they offer better control over settings like ISO, aperture, shutter speed, white balance, and image quality. The key considerations in this technique is lighting, white balance, calibration, shade tabs, and software. Now, talking about the visual shade matching methods. This method relies on the clinician's visual assessment and is influenced by 4 major factors being lighting, patient factors, tooth factors, and clinician factors. Under lighting factors, we have spectral distribution, intensity, direction, and standardization. Under patient factors, we have lip color, skin tone, and eye color. Under tooth factors, we have translucency, opacity, surface texture, age, existing restorations. And under clinician factors, we have color vision status, eye fatigue, experience, and training. Now, the 5 shade matching steps. The first one being check color vision. It is to ensure that the clinician has normal color vision. Step 2 is set light and observer. This is to establish optimal conditions for observation. The third is use appropriate technique. It is to employ methods to improve shade matching accuracy. The fourth is communicate. Document and convey the selected shade accurately. And the fifth step is verify. Confirm the shade selection under various conditions like multiple light sources. Let's move on to factors influencing shade matching accuracy. The first one being lighting, then surrounding conditions, time of the day, patient's natural tooth color, age of the patient, diet and habits of the patient, dental history, translucency and opacity, and metamerism. Now, talking about the tools and aids, we have shade guides, shade matching lights, polarizing filters, digital shade matching devices, and natural gray materials. Moving on to the last topic, which is improving shade matching skills. It involves practice, education, standardization, documentation, and collaboration. Thank you.